While I've spoken directly with many of you one-on-one over the past few weeks, I wanted to make sure we could come together today and provide an opportunity for this collective briefing regarding the recent historic and tragic heat waves as the situation continues to develop. First, let me express my gratitude to our local emergency management partners, support agencies, and the Red Cross and volunteers who stood up dozens of cooling centers across the state, answered calls for assistance, and worked around the clock to respond to heat-related emergencies. These actions undoubtedly saved lives. I also want to acknowledge our partners at the National Weather Service. They provided several days' notice about the record-setting potential of this event, provided updates about where and when we could expect to experience the excessive heat, and shared tips and recommendations for keeping cool during the heat wave. Despite these efforts, however, dozens of Oregonians were not able to get the help they needed and tragically lost their lives. The state medical examiner reports at least 83 deaths attributed to the excessive heat. Please know my deepest sympathies lie with the families who have experienced this loss. As we review the actions of the state and local agencies and organizations, it's important to remember that events like the heat wave are locally driven and state supported. Our local partners know their communities, their resources, and their needs and are best positioned to respond. It's important, however, that the state maintains a level of readiness to support and coordinate our local partners should they need additional assistance or resources. Leading up to this heat event, we transitioned our state emergency coordination calls from the water system chlorine supply issue to heat-related planning and coordination. We joined our state, federal, and local partners in developing messaging and providing resources to help the public make decisions to protect themselves. We also had staff in contact with the impacted counties and monitoring for any requests for assistance throughout the heat wave event. Now, I've been asked a couple of times whether or not the governor should have declared a state of emergency. When I make a recommendation to the governor for an emergency declaration, generally it's because local resources have been or are in danger of being overwhelmed and state assistance is needed. This is typically in concert with a local emergency declaration. Or there are actions the state needs to take using the tools or resources only available through an emergency declaration, or rules that need to be waived in order to effect an appropriate emergency response from the state. We also utilize emergency declarations to request assistance from other states through the Emergency Management Assistance Compact. It's important to note none of these factors were present during the heat event. Now, as we look to complete a state-level review of the extreme heat event, it's important that we understand what happened, what we've learned, and what changes, both immediate and in the long term, are necessary to reduce our risk from these future climate-driven events. We need to move as quickly as we can to gain better understanding and be as proactive as possible in adjusting our response, now knowing there will likely be policy recommendations and necessary critical discussions for state and local governments to consider and to potentially adopt. Some of the things we expect to look at during this after-action review are the number, location, and accessibility of cooling centers and other resources, the speed and frequency with which health-related data is provided to emergency management and responders, how we communicate, or probably more accurately, how we think of risk. We tend to rely on our past experiences to plan for how we'll handle future situations. We've all experienced the impacts of smoke from wildfires, maybe flooding, but now we're experiencing historic flooding in places that didn't used to flood, and fire in places that didn't used to burn. These unprecedented ice storms and record-setting temperatures, these are things that none of us experienced, and we have no muscle memory to rely on. So how we incorporate our changing climate and those impacts into developing our culture and preparedness is really important to our state. This means addressing what our communities need to adapt to high and low temperatures, and neighbors helping neighbors. This means checking in on that elderly couple across the street, or calling your coworker who you know doesn't have access to transportation, or reaching out to that relative who has a medical condition and may be more susceptible to the impacts of heat. This is for events like heat, but also for wildfire evacuations, power outages, or other bad days that Oregon may experience. We know in the last 18 months, we've had a lot of those bad days. It's important to note that these events are not anomalies or outliers. They're indicators of what we continue to expect. It's no longer just about stopping or slowing a changing climate, it's about adapting to climate change. These events impact our state, our region, our economies, and our infrastructure, and our very lives. This is why these types of collaborative reviews are so important to ensure we're ready not for what happened yesterday, but for what will happen tomorrow. And with that, I'll pass it on to Director Allen.
Director Phelps. Good afternoon. I'm Patrick Allen, Director of the Oregon Health Authority. The extreme heat conditions we experienced in Oregon last month seemed otherworldly. Oregon has seen triple digits before, but the notion that cities like Portland and Salem, or even typically warmer places like Medford and the Dalles, could get above 110 degrees, much less surpass 115 degrees, and do so only in late June, seems unthinkable. The reality is that such excessive and deadly conditions may be here to stay. In the last 5 years, Oregon has recorded its hottest years in state history, and unfortunately, this trend is expected to continue. Past climate models predicted more frequent and severe heat waves in our state, and events are bearing out those predictions. Heat waves occur from time to time as a result of natural variability, but human-caused climate change, mainly from the burning of fossil fuels, is contributing to the intensity of extreme weather events here and around the globe. There have been historically few places in Oregon that experience a substantial number of days over 90. Yet due to climate change, nearly the entire state will need to prepare for steady increases in extreme heat over the next few decades. So what are we doing about it? We know these increases in temperatures will increase the number of heat-related deaths and hospitalizations. The Oregon State Medical Examiner, as Director Phelps noted, has reported 83 confirmed heat wave deaths as of July 9th, with an additional 32 deaths pending further investigation. At least 10% of the confirmed deaths were people of color. I want to express my sincerest condolences to the friends and family of those who lost their lives in this event. And according to our hospital surveillance database, there were more than 800 heat-related illness visits at Oregon emergency departments between June 24th and the 4th of July. Heat-related illness is preventable, but only when people have the means to protect themselves. And to help people protect themselves, they need information. To this end, OHA distributed a statewide media release that included information on how people could prevent heat-related illnesses that can lead to heat exhaustion and heat stroke, distributed an extreme heat risk communication toolkit in 11 languages, which was widely used by local public health and community partners, shared information on its website on how people can prevent heat-related illnesses, published 7 extreme heat protection messages on Facebook, reaching 286,000 people and shared more than 3,000 times. We produced daily statewide surveillance summary reports that tracked heat-related emergency department visits and ensured Oregon's coordinated care organizations had the flexibility to identify and provide health-related services, including items for the living environment not otherwise covered by Medicaid, such as air conditioners. Our data show that in this category of health-related services spending, CCOs spent more than $28,000 for 146 members during 2020. We also saw hospitals across Oregon facing high emergency medical services and emergency department volumes. Some facilities experienced power loss. To address this, regional hospital collaboratives convened to discuss and coordinate hospital capacity issues statewide. OHA also urged Oregonians to contact their primary care provider if they begin to experience non-emergency heat-related illnesses such as heat exhaustion, heat cramps, sunburn, heat rash, and the like, to reduce demand on the region's hospital emergency departments and beds. Our work continues for the next heat wave of 2021 and in years to come. The recent heat wave is part of an interconnected web of climate risks, including worsening drought conditions, increasing wildfires, and more flooding events. Governor Kate Brown's executive order on climate change included specific directives to the Oregon Health Authority to work with Oregon Occupational Safety and Health, Oregon OSHA, to propose new standards for protecting outdoor workers from extreme heat. Last week, OSHA enacted temporary rules to ensure urgent protection for workers from extreme heat. OHA's team will continue to work with OSHA on the adoption of permanent rules focused on worker safety from heat and extreme weather. We're also now publishing annual climate and health reports. OHA's Climate Change and Health in Oregon 2021 report will include more detailed analysis of the June heat wave, along with analysis of other climate-related events. The recently passed Healthy Homes and Wildfire bills will create new programs within OHA, that will help to ensure more Oregonians can safely take refuge during extreme weather events. Working with partners is key to planning for the future. We're currently modernizing our public health system and making foundational investments in environmental justice and health equity with a priority on climate. OHA helped to ensure that extreme heat was, for the first time, included in our state's 2020 Oregon Natural Hazard Mitigation Plan. And OHA has launched the next 5-year update of our Climate and Health Resilience Plan to recommend changes in systems and policy we need to protect Oregonians and support communities in their efforts to build climate and health resilience. Finally, because our summer is not over and more days of excessive heat are expected, we continue to encourage Oregonians to do what we're known for, taking care of our neighbors. Remember that older adults and young children are more susceptible to heat-related illnesses, since they get dehydrated more quickly, and their ability to cool themselves might be lower. People with chronic health conditions may be at higher risk. Those with mental illness may not be able to take steps to cool themselves, and those with poor blood circulation are sometimes less able to radiate off extra heat. People who are overweight can also be at risk. Help these folks find and get to cool, air-conditioned public places and cooling centers when their homes get too hot. Encourage them to drink water before they become thirsty. Help them understand the warning signs of heat stroke, heat exhaustion, or complication of chronic illness that extreme heat might trigger. Now let me turn it over to Director Pakseresht.
Thank you, Director Allen, and good afternoon, everyone. I'm Fariborz Pakseresht, Director of Oregon Department of Human Services. Similar to our partners in Oregon Emergency Management and Oregon Health Authority, we were deeply saddened by the loss of lives during the extreme heat, and we express our condolences to their family and loved ones. While we did take proactive steps to help spread the word on the availability of resources, we also recognize there are lessons to be learned and will work with our partners to address those. Oregon Department of Human Services has specific and assigned roles during emergency or crisis. In addition to our regular responsibilities to the population we serve, we also have responsibility for supporting Oregonians by providing food, water, and shelter under the state's emergency management plan in our mass care role. Speaking specifically about the extreme heat, we acted in advance to support individuals in our care and the public at risk. During the week leading up to the heat wave, our staff contacted our providers about their emergency plans. They also contacted other agencies and community organizations to coordinate and prepare for the heat wave. They reminded our providers about their responsibilities, including keeping people cool and making sure air conditioning units were working. They identified individuals who may need assistance with extreme heat and made connections to get the people we serve water and ice packs, and in some cases, box fans when they were available. We notified home care workers and in-home care agencies that serve older adults and people with disabilities that they would be paid when taking a consumer to a cooling center. The Oregon Home Care Commission also sent out information, including text messages to home care workers, personal support workers, and in-home consumers of services. In our mass care role under the Oregon Emergency Management Plan, we provided information to our programs and reminded them on how to access mass care support for the people they serve. We made sure our vendors who supply meals to people in our emergency shelters had plenty of water in stock. We reached out to 211 to see if they would be a statewide information point for cooling center information and coordinated with local emergency managers on how to send their information to 211. We also used social media, specifically Facebook and Twitter, and shared details on where to get cooling center information. And we also encouraged people to submit cooling center information that we may not have been aware of to 211, things such as cooling center stood up by faith organizations. We encouraged people to check on their neighbors. During the high heat, our staff visited cooling centers and large houseless camps to assess the need for water in Clackamas, Marion, Multnomah, and Washington counties so we could provide water where it was needed. We worked with 211 to resolve issues on availability of cooling center information. Over the weekend, we found out that people were having difficulty finding the cooling center information when they called 211. Our staff called 211 and experienced the same thing as were being reported to us. I must point out that 211 is a valued and critical partner. Like many other organizations, Oregon Department of Human Services relies on 211 to provide critical and life-saving information about our services. We found out that 211 was not staffed during the weekend, so we asked what it would take to staff the center so people could get the information they needed. They told us they needed additional funding to staff the center. We then provided funding to staff phone lines 24/7 during the heat wave through 11 p.m. on July 5th. I would also say that we learned much during this response and are working with our partners to make improvements in two specific areas. First, assisting improving access to services through 211. We are pleased to learn that 211 moved its core services to 24/7 on July 10th. They're also making changes to their phone tree to be more intuitive, and they're putting more information about programs and operating hours online. Additionally, Oregon legislature provided $3 million in funding to 211 to expand service capacity and emergency planning and response. That funding was provided during the 2021 legislative session. Second, we are working to improve and develop shelter-in-place strategies for those Oregonians who are unable to leave their home during an emergency due to medical or other limitations, such as significant transportation issues. For that population, often their needs are better served at home. Therefore, we need to look for a shelter-in-place strategy to help them stay safe. We are collaborating with Oregon Health Authority on that strategy. Finally, reiterating what was stated already by Director Phelps and Director Allen, we also need to help people and communities help themselves and one another. We all have responsibility for our own safety, but sometimes we need the help to know what to do. Neighbors, friends, and family can also assume roles and responsibilities to support one another. We intend for our shelter-in-place strategy to include a strong public awareness element to help Oregonians help one another. I'll stop there and turn it over to Ms. Doan from Oregon Emergency Management to start Q&A.
Thank you. I don't see any questions in the chat, so if you have a question, please raise your hand. We'll go ahead and open it up. We've got we'll go a little bit long to accommodate for the late start. KPTV, go ahead.
Hi, this is Simon Gutierrez. Can you hear me okay?
Yes, go ahead.
I was curious about the emphasis on cooling centers and, despite the acknowledgement that the transportation may be an issue for some people, there's also, the issue that most people would prefer not to leave their homes and may be unwilling, even in uncomfortable situations, to do that. Why wasn't there any kind of concerted effort to distribute air conditioning units to people, or vouchers for them, or something that would allow them to stay inside their homes and remain safe?
Pat, I'll go ahead and give that one to you.
Yeah, so I think there are sort of two parts to the answer to that question. I think one is, what supports for people who are on the Oregon Health Plan do you provide to support their chronic illnesses, underlying conditions that make them susceptible to heat, things like congestive heart failure, that sort of thing. And I think when you look at the $250,000 or so that supported those kinds of investments for about 150 people on the Oregon Health Plan, that's indicative of that kind of an effort. I think the challenge, though, is when it's going to be 116 degrees out, it's not a matter of there's an unlimited supply of air conditioners out there and all you have to do is get enough vouchers out to take care of people in the next 48 hours. And I think that's the longer term plan that we do need to figure out how to address. And in the very long run, I think we need to be careful about thinking that air conditioners everywhere is also the answer. That can actually make the problem worse at a community level. And so pretty prosaic things like planting trees in the very long run and what the built environment looks like so you don't have heat sinks are part of the problem. But I think it's a both and. All of those things need to be happening at the same time. The challenge we have, of course, is that we're able to provide those services for people who are on the Oregon Health Plan, not for people who aren't. And so I think there are some places where we need to look at some gaps in services and try to figure out collectively as a system, how can we address those?
Great. Ted Siginger from the Oregonian, can OHA and OEM articulate specific measures they are looking to take to improve their response? And Andrew, I'll have you start with that one.
Thanks, Bobby, and thanks, Ted, for the question. That's really the goal of this after action review, is to see where we can lean forward further. one of the heartbreaking things about this heat wave is that there were resources that were available to communities, whether it were the cooling centers, the transportation that was available, and folks couldn't access those resources to protect themselves. And that's one of the most devastating things about about this heat event. So as we look at the after action review, we do want to assess the location, the number of cooling centers, accessibility of those cooling centers. How could people get to them? Were there enough? Were they in the appropriate communities? And then the other piece is about how we're communicating the types of risk we're now facing. The high temperatures we're facing aren't the same high temperatures we were facing 10 or 20 years ago. The flooding that we're experiencing isn't the type of flooding that we had 10 or 20 years ago. Our risk profile changes, the way we communicate the risk and the way we communicate the actions that individuals can take to protect themselves. Those are all going to come into play and are expected to be outcomes that are deliverables of the after action review process. This was largely an access-driven event. There weren't people being turned away from cooling centers. Cooling centers weren't at capacity. I know that there were challenges with enough folks being able to access transportation to cooling centers, so we want to look at that. So I don't see this as a resource-driven issue. We needed to have more of X available. It's really about, I think, how we can ensure that folks understand the risk of heat. Few of us in Oregon would have ever experienced deadly heat waves like this. And now we've experienced this. We know what this feels like. And I think next time we're going to be much more cognizant of we as Oregonians will be much more cognizant of how impactful extreme heat can be. And I hope we'll all do a better job of reaching out and taking care of our neighbors and seeing what kind of help we can provide at that community level.
From an OHA standpoint, I think I would just add this: the standard structure of emergency response is sort of this ascending hierarchy of entities expressing their need. A local organization or church or city lets its county know that it needs something that it doesn't have, and the county, if it can't meet that need, lets the state know that it can't meet that need. And that's a great system that has been incredibly functional over many years for how to respond to those kinds of sets of issues. I think what we've learned in the pandemic and have now had reinforced in this heat event is there are times where certainly OHA as a state agency thinking about local public health needs to maybe take a more aggressive posture than waiting to be asked, that we need to be asking questions, offering to provide assistance, and really trying to drive more of that from a state standpoint to make sure that things are getting done, to make sure that questions that haven't been thought to be asked have been asked, rather than waiting for those requests for assistance, especially in something fairly fast moving like this kind of a heat event.
Thank you. Gary from EO, go to you for the next question.
Yeah, I'll start out with Andrew. You checked off a bunch of boxes that needed to be checked off for an emergency order. Is it maybe a chance to rethink whether it needs to be these boxes, that something that this major, that affected this many people, should have just been called an emergency because that gets people's attention, even if it didn't check all the boxes?
Well, it's not about checking boxes, I don't think, Gary. And again, I appreciate the question about the declarations. It's not about checking boxes or some kind of a form that I go through. It's what do we get by doing an emergency declaration. I don't think anyone missed the news that there was a heat emergency that was going to be record-setting. When we do emergency declarations, we try to take that process seriously. And leverage that as a tool to access additional resources like interstate mutual aid, or being able to waive rules or regulations that might be inhibiting the state response. We want to make sure that as we're doing emergency declarations, we're not doing that in lieu of a press release or to articulate the severity of the situation. We're doing that as an administrative tool to free up our responses. We certainly need to make sure that the way we're communicating risk and communicating the hazards that we're facing, especially as these hazards seem to be happening with much greater severity and much greater frequency, that we're doing that appropriately. I don't know that an emergency declaration is the best way to let folks know how severe an event is. If you overuse a tool like an emergency declaration just to sound an alarm, that becomes white noise, I think, in the background. So we want to make sure that we're using these tools like emergency declarations appropriately, and then using every avenue we can to communicate risk and let folks know what they can do to protect themselves.
I guess what I would come back to is that the two things that resonate with me that I've heard today from you folks is, number one, expressing how dangerous the situation was, and I think I would disagree with you, Andrew, that people knew how bad this heat was going to be across the board, and that has to come from an official source, I think. And secondly, the inability for people to get in touch with resources during the weekend, and that includes the media getting in touch with PIOs. These are things that need to be looked at. That this was the weekend after the legislature had just gone out, right before the COVID was going to be moving off the state's plate and into the counties. And it seems like there was a lull there, and you got whacked by it.
Okay. Thank you for that, Gary. We always want to make sure, obviously, that our public information officers and all the ways that we provide information are accessible. I really don't want to detract from the incredible work the National Weather Service did the week prior to the heat event. Hourly, it seems, they were providing updates to the forecast and communicating what to expect and when to expect the heat, where it was going to be impacting the state. Oregon Health Authority and many of our other state partners were communicating what to look for in terms of heat-related illness. Tremendous amount of work, and I don't want to discount those efforts at all.
Okay.
Thanks, Gary. Lisa Balick, it looks like you're next up.
Yes, thank you. Just a couple of questions. Some basics that were not there. In other words, the community centers in the Portland area, you can unlock them, let people in, use the air conditioning. All the libraries were only 5 out of about 28 that were open. The pools as well. Why not just say, let's do this? In other words, why does this need to be so difficult when there are so many locations in communities that have a fair amount of space and air conditioning just to say, open them up?
Let me take a crack at that if I could. I think that's exactly the kind of thing when I talked earlier about sort of pivoting from the ordinary emergency response of responding to requests for help to being more assertive at the state level to try to kind of proactively solve problems. And I think about the community centers in Portland, which what I understand from what I've read in the media, weren't able to be open because of budget and staffing constraints and some things like that. And I think, I think that's potentially a role that we collectively, I don't know that that's necessarily an OHC thing specifically, but we collectively as state agencies managing the response to an incident could ask questions like, are there other places that you could open if you had more resources? It would be the kind of thing that I think in a similar event, we can do a more thorough job of to be able to try to anticipate some of those kinds of things and not let something get stuck on a particular decision point, but really come at it with what could you do if you had more of whatever, if that makes sense.
Yeah, I guess more whatever. I mean, the county has billions of dollars in money and we're talking about lives at stake. You unlock the door and let people in. I mean, what's the difficulty here?
Well, I don't want to get into trying to manage how the city or county manage its resources. I'm just saying that as we as state agencies work on responding to an incident, I think we can take a more assertive role in asking some of those same questions earlier and trying to precipitate different kinds of conversations and different answers to those problems.
And a follow-up for Andrew, OEM stockpiles different supplies and resources throughout the year. Why not stockpile fans ahead of time?
Thanks for the question, Lisa. OEM actually does not stockpile resources throughout the year. We've done a bit of work with the Oregon Health Authority, for example, on the stockpile for personal protective equipment for COVID, but we don't have warehouses full of bottles of water or things of that nature. In terms of being able to access those types of resources, those are not just in time resources. Those are the things that we need to start thinking about as communities to reduce our risk, just like we look at smoke alarms. You don't wait until you're going to experience a fire to install a smoke alarm. These are things that we need to make sure that our communities have access to well before the emergency, and understanding that the climate's changing, that we can experience record high temperatures, and I would imagine record low temperatures as well. We need to make sure that basic things like ways to cool down homes, ways to heat homes in the winter, that these are basic necessities that all Oregonians should have access to. I do want to comment real quickly on the last question you asked about the cooling centers and the availability of cooling centers. This is exactly why we're doing this after-action review. The jurisdictions that responded did an admirable job. No doubt they saved lives by the actions they took to establish cooling centers where they did and when they didn't, and as quickly as they did. But we want to make sure that the cooling centers that are established are meeting the needs of the communities. Again, there weren't lines of people to get into these cooling centers, but is that an issue of where the cooling centers were placed, the size of the cooling centers? Do we need to have more cooling centers available in more locations? Are there per capita recommendations we can look at that for every X number of population, you need to have X number of cooling centers with certain capacity? Do we need to look at the proximity of cooling centers to vulnerable populations? This is all stuff that I expect to come out of the after-action review and to have recommendations, not just for the Portland metro area, but for statewide.
Thank you.
Kelly Azar, I've got you next, and then we've got time for two more.
So much for taking the time today to speak with us. The thing I keep coming back to, and I think unfortunately a lot of us are coming back to, is we hear that mistakes were made. We also hear that an emergency declaration wasn't what we needed to make or save these lives. So where does the responsibility lie at the end of the day? We have more than 100 families watching and hearing that mistakes were made and we didn't meet all of the needs and still their loved ones died, but that's not going to make their loss any easier. In fact, it probably makes it harder. So where is that responsibility?
And Kelly, I apologize because you are coming through real quiet on the volume level. So I want to make sure that I'm summarizing your question accurately. But it sounds like you're asking, where does the responsibility lie for the loss of lives, correct?
Yes.
Okay, I'm going to look to Andrew, if you want to take the initial answer on that.
Sure, absolutely. This is a shared responsibility, like all emergency responses are. There are things that we need to look at the city level, the county level, the state level, nonprofit organizations, and again, the individual Oregonians and the responsibilities that we have to take care of ourselves, our family members, and our neighbors and our communities. We can't get through any emergency or bad day on our own. Looking at the impacts of this heat event, the timeline that we had leading into the heat event, knowing what was coming and where those impacts were most likely going to be felt. I think in many ways, the steps that the cities and the counties took to establish cooling centers were the right thing to do. If you look at other states, as we've done as part of the after-action review process to see what state plans look like for dealing with extreme heat emergencies, this is what they call for: establishing cooling centers, proactive messaging, educating communities about the impacts and effects of heat and heat-related illness. This question, I think, really comes down to what else can we do? This is not the heat event from 10 years ago or 20 years ago. These are the heat events we're going to be experiencing in 5, 10, or 20 years. We'll talk to our state partners up in Washington, who also now are reporting dozens of heat-related fatalities as a result of the end of June heat wave. We can't look at this through the same lens as we looked at previous heat emergencies. How do we establish more accessible cooling centers? How do we ensure that folks who don't have access to transportation, that's not the barrier for them to get the help they need? These are all things that are part of the after-action review. Look, in the last 18 months, we've lost Oregonians to unprecedented flooding. We've lost Oregonians to historic wildfires. We've lost Oregonian lives to record-setting ice storms and power outages. Each one of those losses that we've experienced in the state are devastating. In large part, I think they're preventable, but there are things that we all need to do as communities to adapt to these new hazards and this hazard landscape that we're experiencing as a state. We talk a lot about the Cascadia subduction zone earthquake and the things that we're doing as a state to prepare for that, and understanding that on our worst day, a Cascadia 9.0 earthquake and tsunami, we're not going to be able to get resources everywhere that they need to get in the immediate aftermath of that disaster. So developing and fostering this culture of preparedness in Oregon is going to be paramount to surviving that type of a disaster, but we need to apply that same mentality what do you need to take care of yourself and your family for the first couple of days or 2 weeks after an emergency to lessen the impacts and ensure that you're disaster survivors, not disaster victims. So as we look at the heat response, these are all things that we need to not look at the lens from what happened in the past, but what's going to happen in the future.
Andrew, I have a quick follow-up if you can hear me better. I plugged in a mic, so hopefully you can.
Thanks, Kelly.
Can I ask a quick follow-up?
Please.
Okay, so you bring up the historic flooding, the fires, the ice storms, all of the things Oregonians have endured over the last year, where we unfortunately absolutely lost people. In some cases, in this heat wave, we've lost more people, but yet in those cases, we did have emergency declarations. I'm not understanding the difference.
Yeah, so again, the differences are actually pretty stark. And when you look at a flood, you know which houses you need to go to effect a rescue of someone who's trapped by the floodwaters. Even with the ice storms, we could look at the homes that were impacted by power outages and make connections with those folks to see if they needed wood for their fireplaces to keep warm, if they needed food, if they needed to be transported to medical attention. When you have a heat event like this that's impacting millions of folks, it's much more difficult to focus on specific door-to-door type outreach like we experienced for fires, for floods, for the ice storm. And that's what I think makes a response like this so complex. Again, with that declaration, we need to ask what additional resources would an emergency declaration have provided for us, and would those resources have made a difference? There weren't any requests for additional resources from our city or from our counties. They had the resources they indicated that they need. And I think to Director Allen's point, there's an opportunity for us to be a little bit more pressing for all emergencies, especially things like these heat emergencies where you can't see necessarily which homes or which communities are being impacted, to make sure that we're doing that targeted outreach at that city and that county level to meet those needs and to address those folks who may be most susceptible or vulnerable to issues like high heat related events.
Okay, thank you. Pat, Doris, it looks like you're our last question just for the sake of time. Others, if I've missed anyone, please type your question into the chat or feel free to reach out afterwards.
Okay, thank you. And in the interest of covering as much ground as possible, I have a three-part last question. Thank you very much. The first is just a little technical. When should we expect this after action report to be done? Number two, back in 2013, I believe the legislature passed a law allowing air conditioners to go out through coordinated care. And Patrick, you may have mentioned a stat on that, but I'm just wondering how many have actually gone out? Is that a useful program? And then number three, Andrew, you make a great point about things are not what they were 10 or 15 years ago. And I wonder if cooling centers are something from 10 or 15 years ago, and does that need to be taken off the table as something in the future, since as far as we can tell, not all that many people actually used them? Thank you.
I'll take real quick the timeline for the after action review and then the cooling center question. We expect to have the after action review and those recommendations to the governor by the end of this month. Now, it's important to say, looking at the 10-day forecast, at least for the Portland Metro and the Salem Metro area, we don't expect to have record-setting temperatures in the next week to 10 days. We are experiencing really high temperatures out in Eastern Oregon, Malheur County, et cetera. So it's important to understand that we're not waiting for an after action review to come out before we start making changes. Director Pakseresht referenced the pivot on the 2-in-1 system. As we identify things that need to be changed, we will make those changes. The after action review is a formalization or a memorialization of some of these recommendations and processes and additional food for thought. So we'll have those recommendations to the governor and for public release by the end of this month. As for the cooling centers, it's hard to say whether or not those are going to remain a part of high heat related events. I would imagine they will. These are community centers, oftentimes that are accessible to the majority of the public or much of the public. But we need to take a pretty broad lens at looking what other solutions are going to be beneficial for these high heat related events. Director Allen mentioned reducing overall heat islands that we experience in some of these states. In some communities. These are not quick fixes. These are long-term community planning and land use issues that will require much more deliberate thought and aren't something that's going to be fixed in the course of a couple of days.
I'll tackle the second part of the question. And just to refine kind of the circumstance a little bit, it's not so much that the legislature passed an air conditioner program, it's that our relationship with the federal government allows us to use a small portion of Medicaid dollars to pay for things that are about someone's living environment that will help their health, even if it's not exactly a medical treatment or a prescription or a diagnosis or something like that. Air conditioners or box fans are an example of that for someone who's got a health condition that's exacerbated by heat. Organizations have used those dollars to remediate pests in a living environment. A variety of different kinds of things where it's about the place that you live that impacts your health. And as I indicated, in 2020, CCO spent about $286,000 over, I think it was a little less than 150 individuals in those kinds of programs. We want more latitude to be able to do more of those kinds of things, but that's really different than kind of an air conditioner program, which is not at all exactly what it is.
Okay, thank you.
Okay, thank you. For the sake of time, we are done and we're actually over time. So apologies for anyone that we missed. We'll go ahead and put in the chat. It's the same email that you used to register, public.info@state.or.us. I'll plug it in the chat as well. Thank you to all of our directors for the time, and to our media partners, please reach out if you have follow-up questions. Thanks so much.